Hello, everyone. This is Brendan Concannon speaking, also known as a Master of Rehabilitation Science. Welcome to my guide on the St. Louis University Mental Status Exam. Disclaimer: this is not a full demonstration of the assessment. Not every question on the assessment will be covered. You are expected to thoroughly read over all materials before performing the assessment. This guide contains the following contents. Part 1. What is the St. Louis University Mental Status Exam? Part 2. How is the assessment performed? Part 3. How do you score the assessment? What do the scores mean? Part 1. What is the St. Louis University Mental Status Exam, or the SLUMS for short? The SLUMS is a tool used by professionals in social and health sciences to assess a person's cognitive functioning. It was developed in partnership with the Geriatrics Research, Education, and Clinical Center at the St. Louis Veterans Administration Medical Center. Early major tests were performed in around 2003. It is a neurocognitive screening measure sensitive at detecting early cognitive decline, with consideration to specialized populations such as war veterans of varying educational levels. The SLUMS assesses several cognitive functions, but the most notable are short and long-term memory, cognition, executive functioning, language, mental health, reasoning. The SLUMS consists of 11 items requiring the assessed person to solve cognitive problems involving orientation, short-term memory, calculation, naming of animals, clock drawing, and recognizing geometric figures. Scores range from 0 to 30, with lower scores being associated with cognitive impairment. Note that a person's level of education will change how their scores are interpreted. Advantages of the SLUMS. Although there are other assessments that measure cognitive functioning, such as the Mini Mental State Exam, or MMSE for short, the SLUMS has been reported to be 30% more sensitive than the MMSE at detecting mild cognitive impairment. The SLUMS is free to use, while the MMSE requires a fee per test. The SLUMS considers a person's educational background during the scoring process, while other assessments may not. Disadvantages of the SLUMS. The SLUMS is not as widely used as the MMSE, and it has been less researched for validity and reliability. Recent studies, however, have reported the SLUMS discriminates differences between psychometric properties, such as mild cognitive impairment and depression. Main strengths. It can be performed in about 7 minutes with simple equipment. It provides an objective measure of cognitive functioning. Main strengths. Since the assessment is free to use, a Google search for SLUMS exam can easily find it. Main limitations. Sensory deficits, such as blindness and deafness, may impact the validity of the score. The SLUMS should not be used to provide a diagnosis by itself. Other assessments and expert opinions must be considered. Part 2. How is the assessment performed? Disclaimer: this is not a full demonstration of the assessment. This guide will not cover every item on the assessment, and you are expected to thoroughly read over the materials before performing the assessment. Preparation. The following items are necessary to perform the SLUMS: a pencil, an eraser, a 1-minute timer, A sheet of paper with a large circle on it and a sheet of paper with three shapes, a square, triangle, and rectangle drawn on it, specifically like this. It is recommended to copy the image on the assessment itself to make this image. A copy of the SLUMS exam itself. It is a good idea to watch the training video located on the official SLUMS page in advance. It is also important to prepare the examination environment. Key points include: ensure hearing and visual aids are available and in good working order. Check that the location has good lighting and ventilation. Make sure the location itself does not contain clues for answering the questions, such as calendars, newspapers, maps, clocks, etc. The assessment should be performed privately and in the examinee's primary language. The SLUMS is available in multiple languages. Make sure to select the correct language. It is important to select the correct language because each exam will have slightly different wording on the questions depending on what region it is. For example, the default American version will ask, "What state are we in?" while the English Canadian version will ask, "What province are we in?" Introduction. Greet the client and introduce yourself. Ask for the client's name, age, and level of education. Double-check this. Make sure to record the following: the examinee's name, level of education in total years of education or their degree type, and age. Continuing with introductions, at this point, record the patient's level of alertness. Alert means the individual is fully awake and able to focus. Other acceptable terms could be drowsy, confused, distractible, inattentive, or preoccupied. The early segment of the SLUMS examination that records this information will look like this. Note the alertness of the patient line. Continuing with the introduction, request permission to run the questionnaire with the client. Ask, "Would it be all right to ask you some questions about your memory?" Referring to the assessment as a memory test is not recommended. Key rules. Throughout the assessment, it is important to remember the following. Read each question aloud, clearly and slowly. Some patients are older adults and may have trouble hearing. Some questions allow you to repeat information multiple times, such as in question 4 when introducing the 5 objects, while some allow you to repeat only once, such as question 5 when describing the $100 shopping list. If the client attempts to change the subject, reply with, "We can talk about that after the session. Let us proceed with the next question." Here is a sample question. Question 8. Say, "I am going to give you a series of numbers, and I would like you to tell them to me backwards." For example, if I say 4-2, you say 2-4. You state each number by their individual digits. 8-7. Their correct response would be 7-8. 6-4-8. Their correct response would be 8-4-6. This would be worth 1 point. 8-5-3-7. Their correct response would be 7-3-5-8. This would be worth 1 point. This question is worth a total of 2 points. Note that points are only given for the second and last sequence. Here is another sample question. Question 11. Say, "I am going to tell you a story. Please listen carefully because afterwards I'm going to ask you some questions about it. Jill was a very successful stockbroker. She made a lot of money on the stock market. She then met Jack, a devastatingly handsome man. She married him and had 3 children. They lived in Toronto. She then stopped work and stayed at home to bring up her children. When they were teenagers, she went back to work, and she and Jack lived happily ever after. Continuing with question 11, say, what was the female's name? Correct answer is Jill. This is worth 2 points. What work did she do? Correct answer is stockbroker. This is worth 2 points. When did she go back to work? Correct answer is children became teenagers. This is worth 2 points. What province did she live in? Correct answer is Ontario. This is worth 2 points. This is worth a total of 8 points. Do not repeat the story if asked to do so. Note the answer in the 4th line was not directly stated in the story. The patient must interpret the difference between the city and province. If the patient repeats the city of Toronto, prompt by repeating what province did she live in only once. Here is another sample question. Question 9. Show the examinee the sheet of paper with a large circle drawn on it. Say, this is a clock face. Please put the hour markers and the time at 10 minutes to 11 o'clock. This question is worth a total of 4 points. You receive 2 points for having all 12 hours or ticks, and 2 points for the correct hour and minute hands. The correct hand sizes matter. Here is a sample solution that is worth a total of 4 points. Here is another sample solution that is worth a total of 4 points. If they only draw 4 ticks, prompt them once to also show the correct numbers for full credit. Important tips. Read the questionnaire from beginning to end. It is recommended to record the client's response for each question, especially those that resulted in a loss of points. Make notes of any factors that may have influenced the assessment's validity. And now for some do nots. Do not provide hints or prompts for an answer. Do not respond to answers with nonverbal cues such as head shaking, frowning, or nodding. Do not respond to answers with words like, that's correct, or incorrect. Do not indicate surprise, disdain, or disappointment to answers. Do not skip sections, improvise words, or replace objects, such as changing the shapes for question 10. Do not give half points for incomplete answers. Do not forget to record how the client performed the task, especially when they are incorrect. Do not continue the assessment if the client is feeling pain, drowsy, or physically unwell. Part 3. How do you score the assessment? Scoring, for the most part, for the SLUMS has a straightforward scoring process. The assessment shows the point allocation next to each question. However, note that the final score is stratified based on the examinee's level of education. A score from an education level of high school or better will be interpreted differently than a score from someone with less than high school education. For example, a score of 20 for someone with no education is associated with mild neurocognitive disorder, while someone who completed high school would be at risk of dementia. Part 3. What do the scores mean? Throughout the assessment process, It could be that symptoms of cognitive decline may begin to manifest from within the client. For example, symptoms associated with dementia may result in clients who may not necessarily complain of memory difficulties, yet may insist on trying to get the right answer, yet be unconcerned about incorrect answers. Symptoms associated with Alzheimer's may result in clients who show short-term memory difficulty, followed by disorientation to time and place, followed by language deficits, such as being unable to remember or pronounce their nouns. Symptoms associated with delirium may result in clients who show clouding of consciousness, impairing their concentration, possibly leading to frustration. Their lack of attention may compromise the assessment. Visual hallucinations may occur. Fluctuating levels of alertness may occur. Symptoms associated with depression may result in clients showing not necessarily obvious short-term memory loss. They yet may take longer to respond to the questions, and they may either show concern for incorrect answers or give up on the task entirely. Conclusion: the SLUMS is establishing itself as a fast and reliable assessment of cognitive functioning. Attention to preparation and guidelines for scoring can greatly enhance the usefulness of the results. The SLUMS can provide useful information when planning care for a client or determining gaps in their abilities, which can be rectified by education or training. Thank you for viewing this presentation.